I was here about, I think in March, which was when just before the new system went live. So it's interesting being back here 6 months or so after we actually kicked off and seeing where we are. I think general point to make, it's still early days, but what I hope to do in this presentation is just rehearse, as it were, the new system to put the context, say a little bit about transition and then the way ahead. So this slide, I think, is a very useful slide, just reminding us of the Public Health White Paper, which is almost 3 years ago now, and talking about a vision for, as Philip mentioned, putting public health back into local government. It is time to free up local government and local communities to decide how best to improve the health and well-being of their citizens, deciding what action to take locally with the NHS and other key partners, without undue interference from the centre. I suppose you could say, it doesn't say without interference from the centre. We're far too sensible to not leave ourselves a little bit of wriggle room. But the message is very much about localism, putting public health back where it belongs. I'd like to return to that vision later to see how far we've met it. The Act, the Health and Social Care Act, which is the legislative underpinning for the new system, well, basically, Secretary of State has the duty to protect the population of the country, and local authorities, upper tier and unitary local authorities, 152 in England, have the duty in regards to health improvement, to take appropriate steps to improve the health of their populations. They have to put in place a health and well-being board, and I'll say a little bit more about that later. Appoint a Director of Public Health. Director of Public Health has to produce an annual report which the local authority publishes, and Secretary of State can make regulations, which indeed he has done, in relation to the functions of the local authority. Lastly, Health Protection Agency was abolished. Public Health England was put in its place, but Public Health England is not a statutory body, it's an executive agency of the Department of Health. So, slightly dry, but really important legislative underpinnings of the system. Now, here just tries to summarise the elements of the new system. So, government, central government, local government, the NHS, and local authorities. And I'll say a little bit about each of those. So the government's role. I think it's very important to say that the government remains in charge of the overall system. That bullet point 6 talks about government acting as the steward of the system. Secretary of State remains accountable to Parliament and the public for the whole health and care system. But the focus is very much trying to avoid micromanagement of that system and set strategic goals, set outcomes frameworks, allocate money, but then allow the system to get ahead and deliver. Right. Next element is Public Health England. That's quite a busy slide, and I'm not going to go through all of it. I think a key point I want to make about Public Health England is that we've not had a single agency which has tried to bring together all elements of public health before. Obviously, a lot of the staff in the Public Health England come from the Health Protection Agency, but it has a public health-wide remit in terms of health improvement and healthcare public health advice. So this slide lists the various key functions. But I think this represents a huge opportunity to provide public health advice across the range of public health to local authorities, to the NHS, to central government. The NHS, and one of the potential risks of the new system is that the NHS feels, well, public health, that's local authorities and Public Health England's responsibility, not ours. It's important to remember that the NHS England is responsible for over £2 billion worth of public health services, primarily the immunisation and screening programmes. And that's set out in a special agreement. The 7A agreement refers to a section of the 2006 NHS Act as amended. It's not very catchy, but it's really important. But also important is the fact that the mandate, the first mandate to NHS England, contained a requirement to make measurable progress in reducing our mortality rates. And part of this is focusing on making every contact count. So it's really important that the NHS still feels part of public health, and it's doing its bit to improve and protect the public's health. So, local government, and Philip really sort of rehearsed a lot of this. Local government has a long history in public health. It's got a population focus, its role as a place shaper. It can tackle the wider social determinants and health inequalities. It's ideally placed really to pick up public health and really make a difference. There are a small number of mandatory functions that, and I mentioned earlier that Secretary of State can require local authorities to do certain things. So there's sexual health services, National Child Measurement Programme, health checks, advice to CCGs, and advice on health protection arrangements. So there are 5 mandatory functions. Other than that, it's up to local determination, but as determined by local priorities. And that's really important that it is determined by local priorities as set out in the Joint Strategic Needs Assessment and in the Joint Health and Wellbeing Strategy, which delivered through the Health and Wellbeing Board. So returning back to that vision of local authorities leading and having working with partners is absolutely critical, that actually local authorities do have this freedom to try and determine what their priorities are. So there's been great enthusiasm from local authorities for this, and I spent the last 4 days in a London borough doing a peer review, and it was real palpable enthusiasm from everyone, from elected members to officers, for the opportunity that the public health function offers to really make a difference to the local population. And the last point, money. I think it's very true to say that central government has put its money where its mouth is, and so you see the figures there in terms of the public health budget. In terms of the overall local authority expenditure, it's not huge, but it is significantly more than the baseline expenditure on public health, which is transferring from the NHS, and every local authority got a real terms increase. So it's a real opportunity here. So, again, quite a busy slide. I'll just pick out 1 or 2 things. There are various people who have to work together in the local area to really make the system work. I've talked about local authorities' functions. CCGs, obviously, commissioning healthcare services. PHE is providing advice and support at the local level. The key place where the local partners get together is the Health and Wellbeing Board, which has a small number of statutory members. The Director of Public Health is one, but also the Director of Adult Social Services, Children's Social Services, Critically Health Watch, at least one elected member. And this is where the JSNA and the Joint Health and Wellbeing Strategy are agreed. And it's really the place where local agreement on priorities and action has to happen. And it'll be incredibly important already in the new system that the Health and Wellbeing Board is actually bringing people together and critically not just being a talking shop, but a place where strategic issues are discussed and agreed, and then there's action. So, I promised I would keep this brief. This is my final slide. So, how are we done? I think, on the whole, transition has gone very well, and that's not to pretend there aren't issues locally in various places, but it has been a huge, huge change to the system. And that is a testament to incredible amount of work done by a huge number of people, including many people in this room. Public Health England, as I said, I think represents a great opportunity. We've not had this kind of body before. There's this weight and concentration of expertise. We're making progress on sector-led improvement. As I said, I spent the last 4 days on a peer review in a London borough. As a part of the quid pro quo for the pressure on local authorities in terms of financial reductions has been the central government saying, well, we're going to reduce the number of targets, inspection and so on, but the sector has to step up and improve itself. That's working, I think, very well. And will be a critical way of actually local authorities working together and working with themselves, comparing themselves with one another, and really learning what works and then adapting it as necessary to local circumstances. But the challenge now is transformation, and I suppose transformation is a very easy word to say, and I suppose what I mean by it is actually moving to a situation where improving the public's health is core business for every local authority and throughout the local authority, so people in planning, people in social care, as well as public health and so on, regarded as their business, to think about ways they can improve health. And just one example from where I've just been is the fire service in Merton have now been trained in delivering smoking cessation advice. So when they do a home safety check, they can also advise on routes into smoking cessation and indeed some other services, which was actually introduced very quickly, and I saw it's done something which is done in other parts of the country as well. But it's a very good example of just a service which you wouldn't necessarily think is immediately relevant to some of the classic public health services like stop smoking and so on, actually picking up their opportunity to make a difference. So transformation is critical, and it can only take place at the local level. Sitting where I do in Whitehall, we can try and set the framework, we can try and get the messages right and so on, and we can try and get unnecessary obstacles out of the way, but transformation can only happen with local people working together effectively. So that's all I have to say, and I look forward to your questions. Thank you.